Good afternoon, and we hope that everyone will chime in. If you're viewing the program, I would like you to please put any question. This is going to be open to anyone that wants to chime in with questions, with comments, because this is really important. And I'm going to explain what we're talking about and why. I'm Dr. Manon Fielding, first of all, and I'm a holistic practitioner. I've been practicing for about 30 years now, and I'm very passionate about working with women, and mostly I'm working with women in the 45 to 75 age range, and we're focusing on chronic conditions, hormonal imbalances, deficiencies, things that develop over many years and that require a little deeper understanding of nutrition and lifestyle than you normally find in a traditional provider, because their training is so much different. So that's what we're going to be talking about today: the differences between traditional and holistic care, when you would go to each one, dispelling some of the myths that I hear often, and kind of giving you a little bit more information about what you can expect when you go to a holistic provider, myself included. Now, not all holistic providers are the same, just like not all traditional providers are the same. But one thing that I noticed as I was going through menopause and going through the aging process is that anything that went outside of the normal range was, kind of blew their mind, had no idea, just throwing medication. Did you try this? Have you tried that? But nobody really looked at it globally. And that is kind of one of the major differences. I've had issues when I first started menopause, for instance. I had really horrible migraines. They were devastating, and I had very severe anxiety and had a lot of symptoms that were not necessarily estrogen deficiency, like hot flashes is a good one. The thing that I had actually an imbalance and didn't have enough progesterone. And it wasn't until I decided to do my own research and started doing progesterone cream, that a lot of this started to get a lot of improvement. And this wasn't anything that any provider had discussed with me. So this got me on my research and practice. And I was practicing as a holistic chiropractor. I had many women and men in my practice. And I started learning and working with others and working on myself. And this has developed over this many years. So when you go to a traditional provider, you are you're basically looking to get them to check for any signs or symptoms of severe issues. You get blood work. Basically their only toolbox is prescription medications, surgery, and diagnostic testing. And the only kind of testing that they do is blood work. Now, there's nothing wrong with blood work, and that is an important factor, but there are many things that can happen during this period of time that are what they call subclinical. They may or may not show up on a blood test, or the blood test ranges may not really fall. You may not fall in the right range. It might be, now they're starting to notice that there are pre ranges. Like if you're in this one particular range, they might say, oh, you're headed towards blah, 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 and you need to do this, but they're still going to throw medication at it rather than trying to figure out why you have that problem. And I'm going to talk a little bit more about that as we go through this, because so much of it has to do with nutritional deficiencies and other hormonal imbalances that they are not even focused on. All right, so that is, when you have, when for a traditional provider, I would say the most important thing to know is that when you have an acute, you go to for your yearly checkup, that's a good thing, because that allows you to be aware of anything that might be happening that you're not aware of or you're not paying attention to. You go to a traditional provider when you have an acute situation, you have an accident, you have something that's life-threatening, you have heart issues where you're feeling palpitations or your blood pressure may shoot up. You have to go to a traditional provider to deal with these acute issues, and a holistic provider, hopefully, to fill in the gaps and help. Sometimes these things are reversible because you can address the root cause of it. And sometimes they're not, but that still getting the holistic care is going to make a difference. So when you go to a holistic practitioner, the idea is that you're trying to get to the root cause of problems. And I'm going to go through a few of these in a minute. The other thing I wanted to point out is that we live in a country, a very wealthy country overall, where we still are number 72 in mortality rate, and mortality, meaning the number of the people dying per capita. That means 72 other countries are healthier than we are, living longer, healthier lives than Americans. I think that should bring up a question about our healthcare right there. I mean, that is a pretty significant issue. And medical errors are the third leading cause of death in the United States. Third, I can't even hold up three fingers, but third leading cause of death. That is about 200,000 deaths annually due to preventable medical errors. Okay, that's the medical. Another thing that you need to know is that there are over 4,000 surgical errors each year. So medical errors like prescriptions incorrect and surgical are all the kind of things that are issues. And a lot of these things could be prevented, that you didn't even have to go to the hospital. And 1 in 25 patients who go to a hospital develop a significant infection while they're in the hospital. Many of them are fatal. So the idea is, let's do what we can to prevent, find the underlying cause, and not have to be in a situation. Let the emergency doctors and the medical doctors handle the acute and the emergency. And then the holistic doctors are the ones who are going to get to the root cause, look at you as a whole person, spirit, and try to get to the underlying causes. So let's talk a little bit more about that. So let's say, for instance, you are experiencing some of these hormonal issues. Take, for instance, the hot flashes that you're experiencing. Hot flashes, mood disorder, brain fog. You have a whole host of things and they put you on HRT. Well, one of the things that we're finding is that more women who go on HRT develop thyroid disease than women who don't go on HRT. Is that because of the HRT, or is it just because it kind of covers it up and they don't actually ever get to the root cause of the problem? It's a combination of things. So apparently estrogen can influence your thyroid hormones and deplete them. So if you get too much estrogen, without balancing the other hormones, then you can end up with the thyroid disease and you get on thyroid medication. And the thyroid may be problematic because of the estrogen. And also, we're finding very significant that vitamin A, vitamin D, selenium, and iodine, some other nutrients, when they're deficient, it causes the thyroid to be hypothyroid. And some of these also can lead into the autoimmune conditions of Hashimoto's. So it's Hashimoto's and thyroid disease are very prevalent. I think it's like 10 times more prevalent in women than in men because of these hormonal imbalances that are never dealt with, and we never get to the root cause when we go through the traditional medical model. And that's really, to me, way too much. I hope you agree with me on that. So the other thing, so we were talking about the nutritional deficiencies in thyroid. Selenium is required to make our thyroid hormones. And so part of it is because of nutritional issues where we're not getting enough selenium from our food because it's not in the soil. If it's not in the soil, then it doesn't get into your food supply. And it is more likely to get from seafood. I forgot, I think eggs may be selenium. So there are different, like if you're a complete a vegan, it might be even harder where you think you're eating all these fruits and vegetables and you shouldn't have a depletion, but selenium's not in the soil and it is in animal products, then you're even more prone to it. So you're going to have to find some kind of sources of selenium that you can eat, like kelp or seaweed. You have to just work harder at it. And you're going to, if you don't do that, you're going to be much more susceptible to thyroid issues. And that is difficult. So the other thing that I hear about holistic practitioner is that we're not scientific or we don't have the training. Well, that's not true for the most part, because most holistic practitioners have advanced degrees. They may be at a doctorate level. Most of them are at a doctorate level, like myself. And I have a doctorate degree. I have a master's degree and I'm also certified in various life and coaching programs. So I really have the expertise, I have the knowledge, and most of the holistic practitioners that I meet are on a similar scale. And they spend their time looking at things holistically and putting the time in to do that. Whereas the training that medical doctors get, from what I understand, and I've looked into this, they may or may not have any nutrition background whatsoever. That in a lot of medical colleges, you don't even get a course in that. Whereas in my program, which is still many years ago, I had a year of holistic nutrition in my doctorate program. And then many years of certification and extracurricular that I'm studying that. So a lot of the medical doctors, a lot of their programs come from the pharmaceutical industry, and they're very focused on medication. That's where their focus is, and on their testing. I personally am very scientific in my approach. Everything that I do is based on research, and I use the most advanced scientific testing in my program. So for instance, women, we do the hormonal test. So there are two hormonal tests that I really use the most. One is called the Dutch Complete. The Dutch Complete looks at, I think it's 7 different hormones, but it's not just the hormones. They look at the metabolism of those hormones, because a lot of women, their blood may test being low on something, but it's because of the way they're metabolizing it. Maybe they're metabolizing it too slowly, too quickly. And there's also a problem with I'm trying to explain this the right way, the pathway that the estrogen gets metabolized. It can metabolize and become a toxin in our body, which makes it more prevalent to get breast cancer. And it can be processed and metabolized through the liver in a way that we can excrete it properly, where it doesn't become toxic. So that is part of this Dutch Complete test, which I think is amazing because it can prevent some of the cases of breast cancer that come from that incorrect metabolism. It also looks at various anti-aging factors. It looks at other different types of nutrients like vitamin D. It looks at the DHEA. It looks at cortisol over a 24-hour period, because cortisol fluctuates a lot over a 24-hour period. And it is responsible for a lot of the problems that women experience in menopause, because there's also the added stress, the physical stress, the stress that we have at home, the stress of changing families that happen a lot during midlife, changes in work environment. So stress is a major factor. And if we don't learn ways and we can't, when I go to the medical doctor, they don't teach me how to meditate. They don't teach me how to do heart math, which now I'm certified in. They don't teach those kind of things. And they really are essential for us getting connected to ourselves and learning how to be in touch with our body and our mind and our spirit, so that we make the best decisions on a moment-to-moment basis. So much of the time, women are not focused on themselves. They're focused on everyone else, on their family, their significant other, rather than focusing on themselves. And that's one thing that I find is really important in a holistic program, is learning to focus on yourself and take care of yourself, so that you can also take care of others and be there for others. And that's why I thought this was kind of a great analogy. When you get on an airplane, they tell you to always put the oxygen mask on first before your kids, if you have children with you, or always put it on first, then worry about them. Because if you pass out because you don't have enough oxygen, you're not going to be able to help anyone else. So it's always a good idea to take care of ourselves, so that we can then take care of others. All right, so I talked about the Dutch Complete, and it looks at all these different hormones over time, looks at the metabolites, looks at anti-aging components, and it's pretty amazing. And you're not going to get that when you go to a traditional doctor. Okay, then there's the weight loss panel. So some women, their major issue is weight. At least that's what they're focused on. And I understand that. I had gone through a period where I had gained a significant amount of weight, and you just don't feel good physically. You don't feel good emotionally about yourself when you feel like you're looking your best. And so weight loss is an important factor. And a lot of women gain weight when they go on HRT. Now, it's not the HRT that's causing it. It's the fact that like we were saying earlier, that they have other imbalances or deficiencies that are leading towards that weight, or they're not doing things in the right way. Like if your metabolism has slowed down because you're developing thyroid disease and you're not aware of it, you could be doing the complete things for weight loss. And I have another video about that. I'm not going to go into detail about it, but the weight loss panel is going to look at that. It looks at the nutritional deficiencies, and it looks at the hormone imbalances. And that way we have a complete picture devoted towards weight and weight management. Part of our targeted solutions program. So that program is 12 weeks long, and it allows you to really focus on a particular issue, just the hormonal imbalance and some of the physical issues. Maybe you have a lot of pain. That's another thing that I see, joint pain, back pain, this weight management, could be sleep issues. A lot of women have the significant sleep, or anxiety and depression and brain fog. Those can all be significant. And this will really help us key in on it. And as a holistic practitioner, we're going to work on that mind-body connection and help alleviate those symptoms without medication. And that's a key here, is helping women to the underlying causes without medication that has potential side effects. And almost every medication does, especially the ones that are mind altering that we take for depression, anxiety. Now, that doesn't mean that you should never take these things. If you've been in some kind of a traumatic scenario and you need to take some medication to really get your body calmed down a little bit, there's nothing wrong with that. But when we start becoming dependent on it because we have hormonal imbalances that could be corrected and by other means, and working towards a more holistic solution for the long term, that's where the problems come in. Because long-term use of these mind-altering medications actually can set us up for future dementia and Alzheimer's, which is also rampant in, I wouldn't say rampant, but 10 times more prevalent in women than in men. All right. So then we talked about some of these issues that getting to the root cause rather than dealing with the acute situation. The other thing with anxiety that I might have mentioned earlier, that was one of the things that I had a lot of issues with. And holistically, when I started the progesterone, that helped a lot. The other thing that helped a lot was some herbal remedies, one of them being ashwagandha. I found ashwagandha to be amazing for kind of mild to moderate anxiety and depression. It really helps lift your feeling of well-being without causing any side effects, and it's completely natural, so that it's not going to affect you if you stop taking it. Like with anxiety meds or other kinds of medications, you can't just get on and off of it. You have to really taper really slowly. The other one is maca. Maca is an amazing underlying, it's not really an herb, it's a nutritional product. And the kind that I get comes from Peru. And they make specifically for reproductive years, for perimenopause, for postmenopause, and they also have a men's version. And all of these kind of nutritional and herbal remedies help to not only deal with the symptoms, but they prevent a lot of disease because they're nutritionally beneficial to your body, and they help your body function at a more optimal level. So it's going to help your adrenals function better. Your adrenals are supposed to kind of take over your adrenal. There's more work to be done, so to speak. When your ovaries shut down, you stop producing estrogen, your other hormonal organs, if they're not at peak performance, you're going to have some breakdown in those systems and have symptoms that be effective of that. So the idea is to provide the proper nutrients and the proper thinking and physical well-being for you to function at your optimal level and be vital and healthy. It's not just about living longer, because all my programs will help you reverse your age to some extent. It's more about the vitality and being healthy and happy in your life. All right, so the other thing that comes up sometimes is, what about cost? You know, it costs a lot more to go, and that seems to be a barrier to a lot of people to go to a holistic practitioner and get involved in holistic care. And I'm not immune to that. I completely understand how that can be. The cost is going to be an increased upfront cost right? Like it's going to cost a little more. You're going to pay, like if you go to your doctor, you're talking about a copay versus paying. I don't, depends on what if you're going to a holistic practitioner for one time, or if you're going for a program, the cost is going to vary significantly. But that upfront cost is going to pay for itself over and over and over when you look at the long-term cost. Long-term costs, real physical costs, because you're not going to have to go to the doctor as much. You're not going to have to go to the hospital. You're going to be preventing cancer, heart disease, a lot of the things that can end up being very expensive, even with insurance. And think about what you're doing for your well-being, like your health, not having to worry about developing a lot of these diseases. And a lot of people say, well, genetically, my mom and her mom had Alzheimer's or dementia, I'm probably going to get it myself. And there's a lot of fear around that. And you almost end up causing it by having this incredible fear that underlies what you do, but you're not really changing anything about your life to prevent that from happening. So when you consider the cost of time and money and long range health, the cost of holistic care is really minimal. And most practitioners have some kind of a payment plan. I know we do in all of the programs. So I have, like I said, I have two programs. One is that one that's more focused on specific health conditions, and the other is a longer term 12-month program, transformative, actually looking at 134 genes and getting genetic testing, and then using our nutrition lifestyle correction to help improve your epigenetics. And I'm not going to go into a lot of detail about epigenetics, but we have found through scientific testing that we actually have an influence on our genes. And if you have, just an example, a propensity, if you have a gene that could lead towards dementia, and that is a genetic predisposition, there are things that you can do that have proven to like shut down that gene or not activate that gene. I don't know which is really the most correct way of saying that, but if you already have that, then there are things you can do. And then there are a lot of preventive strategies to prevent breast cancer, for example. I recently attended a conference on vitamin D, and one of the scientists was talking about how 82% of breast cancer can be prevented with the right level of vitamin D. That right level is not the level that most doctors are recommending. That right level is between 60 and 80 nanograms per deciliter. Milliliter, I'm sorry, nanograms per milliliter. Most doctors are getting their patients between 40 to 60. I don't know why, but when it's 60 and up, there's a huge improvement in a decrease in prevalence of all kinds of cancers. So, and how much does it cost to take a little vitamin D capsule? Pretty much cents a day. Really, it's probably one of the most inexpensive nutrients that you can buy. So I highly recommend that. Those are the kind of things that you really need to be seeing a holistic physician for. What about autoimmune? We talked, a lot of women that I meet have Hashimoto's. So you might need a much higher level of vitamin D intake to have the same levels in your body because of the way it's processed when you have autoimmune challenges. I have heard anywhere from 10,000 IU per day to 50,000 IU per day. And they find that even at that very high level, 50,000, that there are little or no side effects. I know that there's been a fear in the medical profession of increasing kidney calcification, but that has not proven to be true in research. And if it is something that is potentially a problem with a particular patient, taking vitamin A, D, K will actually help to prevent that calcification. So there's plenty of ways around it. But holistically speaking, if you could help reverse a lot of the effects of some of these autoimmune diseases, wouldn't that be worth it? I mean, I think it would be. It would be for me. I don't have any of those, but I think it would be an amazing improvement. Now, this is not a cure. We're not saying that we're curing any of these diseases, but we can reverse a lot of the effects of it and prevent it from developing increasing problematic, that we can kind of stop it where it's at and help reverse a lot of the effects of it and live a more normal, healthy life. And the earlier that we do that, the more improvement we can get. All right, let's see, what else did we want to talk about? I think those were a lot of the major issues that I wanted to review. And I really appreciate everyone participating today. We're on several different platforms. Let me see if we have any other questions here. Okay, so one of you are asking about the statistics on the thyroid disease and why it's so much higher when you take HRT. They have found that because if you're on HRT, you're taking a steady level of estrogen, and you might have already had some of the conditions of hypothyroid and didn't realize it. And when that happens, you have this interaction between the thyroid and the estrogen, which reduces the ability of the thyroid properly, is basically what my study has found. So it's really important in that case to reevaluate the HRT, for one, that you may not be on that. And there are other ways of increasing estrogen more naturally. So the maca was one of them. Estrogenic foods is another one. Taking more progesterone, the progesterone cream will help a lot of the symptoms that the estrogen was being taken for. And then secondly, to maximize the improvement of your thyroid. And that involves a lot of lifestyle factors, like we were saying, to check the nutritional status of your vitamin A, D, K, selenium, iron, iodine. So those are the ones that are most involved in thyroid. You know, make sure that we have that. Then make sure that your lifestyle is supporting the benefit of the thyroid. You know, one thing I found recently in working with some women with thyroid issues is intensive exercise actually shuts down your thyroid. When you think that you're doing intensive exercise and you really are trying to increase your metabolism, you're actually causing the reverse. So that's where, like I was saying, that working with a holistic practitioner will help you set up a program that's right for your specific condition and not just trying to fix it on your own. There are a couple on my YouTube channel. There are some videos about this, so please watch it if this is a question that you have. So if there are no other questions, I am going to close this talk today, and I appreciate you participating today. Thank you, and I hope you have a wonderful weekend. It is a Friday today, and I look forward to